Flexible endoscopes have been an invaluable tool in the medical community's armamentarium to successfully diagnose and treat a wide variety of illnesses in patients for decades. Over the years, design changes have simplified their clinical use and augmented their functionality while increasing their technical sophistication. Special reprocessing instructions must therefore be followed to ensure that these heat-sensitive medical devices are patient-ready and patient-safe. This educational video is intended to provide guidance to healthcare professionals on the manual cleaning and high-level disinfection of Pentax gastroscopes, colonoscopes, and duodenoscopes. The demonstrations in this video are meant to supplement but not replace the complete and detailed reprocessing instructions contained in the reprocessing maintenance manuals supplied with each Pentax endoscope. Proper cleaning and high-level disinfection processes must be performed prior to each and every procedure to maximize the performance of the endoscope and to minimize the risk of contamination from pathogenic microorganisms. Pentax reprocessing instructions, as depicted in this video, are consistent with reprocessing guidelines developed by various national, professional, and medical organizations and governmental agencies. The following instructions contain detailed recommendations on the manual reprocessing of Pentax endoscopes using Pentax applied cleaning disinfecting adapters. Automated endoscope reprocessors, or AERs, are also known as endoscope washers disinfectors in some areas. AERs may provide a means of automated reprocessing of flexible endoscopes, including Pentax instruments. However, only those automated endoscope reprocessors should be used whose manufacturers provide device-specific instructions and have validation data, including simulated use studies that support each AER claim with respect to Pentax 70, 72, 70K, 72K series instruments. AER manufacturers should be consulted for their specific claims and written instructions for reprocessing Pentax products, including but not necessarily limited to the ability of the AER to provide a cleaned and high-level disinfected or sterilized endoscope and scope components, for example, valves. The identification of any special feature area or internal channel or scope component that cannot be reprocessed by the AER and therefore requires manual reprocessing. The microbial quality of the rinse water. The inclusion of an automated rinse cycle. The inclusion of a terminal drying cycle that removes residual water fluid from within the scope channels. Maintenance procedures for water filter replacement and/or decontamination of the filtration system to ensure microbial claim of the rinse water, etc., and compliance with local and federal regulations and/or national guidelines. Pentax reprocessing procedures can be broken down into 5 basic steps: pre-cleaning, leak testing, cleaning, high-level disinfection, and post-disinfection. Each of these steps will be reviewed in detail during this video presentation. It is extremely important that anyone involved in the reprocessing of flexible endoscopes should be trained in infection control practices, receive device-specific reprocessing instructions, and pass competency testing on a regular basis for the reprocessing of endoscopes. Personnel responsible for reprocessing reusable medical devices should clearly understand the significance of meticulous mechanical cleaning. Cleaning is the single most important step in the entire reprocessing procedure and must be performed prior to any subsequent disinfection or sterilization process. Pre-cleaning should be performed in the examination room immediately after the endoscopic procedure. If the endoscope or scope components are left unclean for some time after use, dried blood, mucus, contrast material, or other patient debris may cause damage to the instrument or component, or may interfere with the ability of the reused item to be adequately reprocessed as intended. Pre-cleaning goals: to remove gross patient material from the external surfaces of the endoscope, to purge internal channels and prevent drying of debris within the channels, and to begin pre-soaking of the removable scope components. Leak testing should be performed in a decontamination area prior to immersion of the endoscope in any cleaning detergent solutions. Leak testing goals: to identify any leaks or compromised areas of the endoscope which could potentially harbor microorganisms and act as a source of contamination if left unrectified. To confirm the watertight integrity of the instrument and to minimize the damage and repair costs associated with leaks. Cleaning should be performed in a decontamination area prior to any subsequent disinfection or sterilization process. Cleaning goals: to lower or minimize the number of pathogenic organisms remaining on the endoscope, to reduce or remove the amount of patient debris, blood, mucus, etc., which may be left on the endoscope, within its channels, and/or on removable scope components. Cleaning is always followed by a water rinse step to remove residual detergent and debris and to prevent dilution and/or adulteration of the disinfectant. High-level disinfection should be performed in a decontamination area. It is imperative that one ensures contact of all internal and external endoscope surfaces with a legally marketed high-level disinfectant sterilant. Disinfection goals: to remove, inactivate, or kill pathogenic microorganisms which may remain on an instrument after cleaning to render it patient-safe for subsequent use. After high-level disinfection, a water rinse is required to remove residual disinfectant. A final alcohol rinse followed by forced air should then be applied to thoroughly dry instrument surfaces. Post-disinfection. Following disinfection, the endoscope may either be reused or stored. Post-disinfection goals: for reuse, to ensure that the instrument has been properly inspected and fully prepared for use before the next clinical procedure. For storage, to ensure that the instrument has been sufficiently prepared for storage in an acceptable environment, such as a cabinet. Preparation needed supplies. The following is a list of some of the most important supplies required to reprocess your Pentax flexible GI endoscopes. Personnel protective equipment such as face shield, eye protection, full-length gown with elasticized wrists, and gloves. Gloves must be suitable for the particular reprocessing agents used. Compatible enzymatic detergent. Compatible high-level disinfectant. Chemical indicator or MEC test strips to check the minimum effective concentration of the active ingredient in the liquid chemical germicide. Isopropyl alcohol. Sterile or microbe-free rinse water. Plastic basins or tubs with lids that are large enough to safely accommodate the endoscope without excessive tight coiling. Gauze or lint-free cloth. Syringes, 50 to 60 cc's, 30 cc's, 3 to 5 cc's. Pentax leak tester. Pentax cleaning brushes. Pentax applied cleaning adapters. Pentax soaking cap. Suction source. Compressed or forced air not greater than 24 psi. Timer. Pentax reprocessing maintenance manual. Decontamination area with appropriate ventilation or other engineering controls to protect healthcare workers from repeated use of reprocessing agents. Transportation trays or containers to safely carry contaminated instruments. Warning: the importance of meticulous mechanical cleaning of the endoscope and its removable components cannot be overemphasized. Prior to disinfection or sterilization, all instruments and components must be scrupulously cleaned. Failure to do so could result in incomplete or ineffective disinfection or sterilization. Pre-cleaning in the examination room. The first instrument depicted in this video is a conventional forward-viewing upper GI endoscope or gastroscope, which has a total of 3 internal channels, one for air, water, and instrument suction. Immediately after removing the endoscope from the patient, gently wipe all debris from the insertion tube with gauze or the like, moistened with an enzymatic detergent solution. Place the distal end of the endoscope into detergent solution and aspirate through the channel for at least 5 to 10 seconds. Alternate suctioning of air and solution several times to create agitation for better pre-cleaning. Set the lever on the water bottle to the drain position. With the air pump of the video processor on and set to the highest pressure setting, depress the air-water valve of the scope fully until all water has been discharged from the scope. Alternate covering the hole in the valve and depress the valve to forcefully expel mucus, debris, etc., which may have entered the air and water nozzles. Warning: immediately after use, the light guide prong and the electrical contacts or pins of the endoscope may be hot. To avoid burns, do not touch these areas immediately after use. For safer handling, grasp the PVE connector housing. Remove all endoscope components, suction valve, air-water valve, etc., and place in a container of enzymatic detergent solution. Carefully coil the insertion tube and umbilical cable. Place the scope in a covered transport container, minimizing exposure to potentially contaminated patient material, and carry the scope to the cleaning room. Leak test in the decontamination area. Before proceeding with any further cleaning steps, the endoscope must be leak tested. The Pentax leakage tester allows for a simple two-stage testing of the watertight integrity of Pentax endoscopes. Air pressure is delivered by means of a hand-operated bulb, eliminating the need for any electromechanical devices. Always ensure that the red ETO gas sterilization cap is off and the appropriate soaking cap is attached to the endoscope over the electrical contact pins prior to any immersion in fluids. Stage 1. Dry test. All valves, inlet seals, and other removable components should be detached from the scope prior to leak testing. The dry leakage test should be performed prior to immersing Pentax endoscopes in any fluid. This test detects any major loss of the integrity in the endoscope's watertight construction. For example, major tear in the instrument channel. Secure the leakage tester connector to the venting connector on the scope light guide. The leakage tester connector and the venting connector on the scope light guide must be dry before connecting. Proper connection will require alignment of the venting connector pin and clockwise rotation of the leakage tester connector. Ensure that the needle in the gauge is set to 0 and the pressure release mechanism is closed. Pressurize the scope by pumping the hand bulb until the indicator on the gauge is in the green zone. Do not pressurize into the red zone as it may cause serious damage to the scope. Note: during the leak test procedure, the insertion tube of the scope should be flexed in various positions, and the distal bending section should be fully angulated in all directions to confirm the absence of a leak. Observe the gauge pressure to determine if the indicator remains in the green zone. If the indicator drops rapidly from the green zone, a major leak may be indicated. Note: be certain that the pressure release valve on the handle of the leakage tester has been tightened. Do not immerse the endoscope if the gauge indicator does not remain in the green zone. Stage 2. Wet test. After determining the absence of any major leak in Stage 1 testing, Pentax endoscopes may be immersed to test for loss of integrity in their watertight construction. With the leakage tester securely attached to the scope pressurized with the gauge indicator in the green zone, and the soaking cap securely attached over the electrical contacts, the entire scope, with all valves and inlet seals removed, may be immersed in clean water. Note: only the leakage tester connector and a small portion of its tubing should be immersed. Never immerse the entire leakage tester. Observe the instrument carefully while fully angulating the distal tip of the scope. A few bubbles may occur initially from recessed areas of the scope. This is normal. If a continuous stream of bubbles is observed from the same spot, a leak is indicated. Immediately remove the scope from the water. Do not use the scope. After removing the scope from the water, release the air pressure within the scope by opening the pressure release valve on the handle of the leakage tester. After the gauge indicates 0, disconnect the leakage tester from the scope. Note: never connect or disconnect the leakage tester underwater. This will cause leakage of water into the scope and leakage tester. If a leak was discovered in Step 2, follow decontamination procedures for returned instruments as described in a separate document and contact your Pentax service center. If no leak was discovered in Step 2, you may proceed with standard cleaning and disinfection of the scope. Cleaning in the decontamination area. After confirming that the endoscope has no leak, prepare a basin of fresh enzymatic detergent solution, following the instructions provided by the manufacturer of the detergent solution. Fresh enzymatic solution should be prepared for each instrument. Caution: the use of an enzymatic detergent immediately after each procedure to dissolve and remove organic contaminants and proteinaceous debris is essential to the care and maintenance of the endoscope from the standpoints of infection control and functionality. Immerse the endoscope in detergent solution. All scope components, including the suction valve, air-water valve, inlet seals, etc., which were previously removed, can now be transferred to a cleaning solution in the decontamination area. Allow all items to soak in the enzymatic detergent solution for the time period recommended by the manufacturer of the enzymatic detergent. While fully immersed, manipulate valve mechanisms and inject detergent with a syringe into or through removable scope components. This will remove air bubbles and provide for better exposure of all surfaces to the detergent. Note: do not place any endoscopic accessory instruments such as biopsy forceps or other sharp-edged objects in the basin with the endoscope. Thoroughly but gently wash all external surfaces of the endoscope and scope components. Do not squeeze or severely bend the insertion tube. Do not use any abrasive materials. Manual cleaning of the suction system by brush. A variety of special brushes have been provided to mechanically brush clean the entire suction instrument channel. Reusable brushes should be examined before use and should only be used if they are in good condition. Whenever possible, the entire endoscope should be immersed in detergent solution during the remaining of the cleaning procedure. Note: prior to inserting a used cleaning brush into any channel or opening, always clean off the bristles to avoid reintroduction of patient material and/or contaminants back into the scope. Brush clean the entire instrument suction channel system. Using the long single-use cleaning brush CS6021T, insert the back-end blue tip of the shaft of the brush into the opening of the suction nipple and gently pass the brush until it appears in the suction control valve receptacle. Grasp the back end of the brush shaft and gently pull the brush from the receptacle. This will clean the suction tube within the light guide umbilical cable. Repeat if necessary until a clean brush exits the suction channel. Insert the blue-coated end of the cleaning brush CS6021T into the opening at the bottom of the suction control valve receptacle on the control head and gently advance until it exits the distal tip of the scope. Grasp the back end of the brush shaft and gently pull the brush from the scope distal tip. Do not use excessive force. Repeat until bristles are visibly clean. Caution: the CS6021T brush is for one-time use. Never reuse the brush on more than one endoscope. The brush must be removed slowly from the endoscope, being careful not to fling patient debris contaminants into the air as the bristles exit the scope. Insert the large bristle of the cleaning brush CS-C8S into the instrument channel inlet and scrub clean surfaces inside the channel inlet port. Repeat several times, ensuring that only a clean brush is introduced into the channel each time. Using the large bristle of the cleaning brush CS-C8S, scrub clean the surfaces inside the suction control valve receptacle on the control head. Note: Be sure to inspect the bottom of the suction control valve receptacle for any debris. Scrub all internal and external surfaces of the suction valve OFB177 using the smaller side of the cleaning brush CSC8S. The rubber inlet seal OFB173 should be disassembled and all surfaces brushed with the CSC8S cleaning brush. Manual cleaning of the air-water valve and the air-water valve receptacle on the control head by brush. Remove the air-water feeding valve OFB178 and scrub all internal and external surfaces of the valve using the smaller side of the cleaning brush CSC8S. Note: ultrasonic cleaning is recommended for removable scope components and reusable accessories whose entire surfaces may not be easily accessible for manual cleaning, such as certain valves, inlet seals, etc. This may be completed after manual cleaning by brush and soaking in detergent, but prior to subsequent high-level disinfection or sterilization. Using the larger end of the cleaning brush, scrub clean the surfaces inside the air-water cylinder. Make sure that all recessed areas of the endoscope, including valve cylinders, channel openings or ports, distal tip, air-water nozzles, elevator mechanisms, etc., are manually cleaned. Chemical cleaning by detergent solution. Note: brushing of the internal channels is not a substitute for exposure to an appropriate cleaning solution. Manual cleaning by brush complements and augments the cleaning effectiveness of chemical cleaning, for example, enzymatic detergent. The rubber air-water instrument channel cleaning adapter OFB166 should be attached to the air-water cylinder and suction cylinders. This adapter caps or seals off the air-water and suction cylinders to allow for unidirectional flow of solution through these channels. Note that the symbols on the OFB166 show two circles, which represents the shape of the respective cylinders for proper attachment. Note: it is imperative that the OFB166 channel cleaning adapter is securely attached to the respective cylinders. Failure to properly match and secure the cleaning adapter could result in ineffective and incomplete reprocessing. To clean the air and water channels. The air-water channel cleaning adapter, model OFG17, must be connected to the air-water port on the PVE connector. It has a standard luer lock connector to which a syringe should be attached. Fresh detergent solution should be flushed through this connector and will simultaneously flow through both the air and water channels within the scope. Provided the enzymatic detergent solution is allowed to remain in contact with the internal channel surfaces for the recommended exposure time, the enzymatic solution should dissolve and clean any remaining debris within these channels. To clean the instrument suction channel system, install a rubber inlet seal on the instrument channel inlet. Attach the suction channel cleaning adapter OEC8 to the suction nipple located on the PVE connector. Attach a syringe to the cleaning adapter and flush fresh detergent solution through the entire instrument suction channel. Warning: the enzymatic detergent solution should remain in contact with all internal channels and external scope surfaces for the time period recommended by the manufacturer of the detergent. Prior to rinsing, purge all internal channels with air using a syringe to expel residual detergent solution from the channels. Using clean water, immerse the entire endoscope as well as all removed components in a basin of clean water. Thoroughly rinse all items. With all cleaning adapters attached to the scope, flush all previously air-purged channels with clean water. Repeat. Warning: it is important that all internal channels, air, water, and suction instrument, external scope surfaces, and components be thoroughly rinsed with clean water to remove residual detergent solution. Rinse water remaining within the channels should be purged with air to prevent dilution and/or adulteration of antimicrobial agents to be used in the subsequent disinfection or sterilization process. Note: 70% alcohol followed by compressed air, not greater than 24 psi, may be used to facilitate drying. Gently dry all external surfaces of the endoscope with a soft gauze or the like. Do not put tension on the insertion tube of the endoscope while drying, since the outer cover of the bending section may be excessively stretched. Warning: prior to disinfection or sterilization, it is imperative that any solutions previously used in the cleaning process be thoroughly rinsed. Failure to do so could result in ineffective or incomplete disinfection or sterilization. High-level disinfection. Before any attempt is made to disinfect the endoscope, the entire cleaning procedure must have been completed. Prior to high-level disinfection, the end user should confirm the minimum effective concentration, or MEC, of reused disinfectant as per the manufacturer's instructions. The air-water instrument channel disinfecting adapters, consisting of two separate components, OFB166 and OFG17, should already be installed on the endoscope from the previous cleaning procedure. Model OFG17 incorporates a standard luer lock connector to which a syringe should be attached. Fresh or reused actively effective disinfecting solution should be flushed through this connector and will simultaneously flow through both the air and water channels of the scope. Warning: avoid introduction of air during the flushing process. Confirm that no air bubbles exit the channel openings at the scope distal tip. The presence of air bubbles could prevent contact of the disinfectant with channel surfaces. After the entire scope is completely immersed and the air and water channels have been filled with disinfecting solution, model number OFG17 should be removed. Adhere to proper exposure times for the disinfectant. Confirm that a rubber inlet seal is already attached to the channel inlet for the next step. The suction channel cleaning adapter OEC8 must be attached to the suction nipple located on the PVE connector. Attach a 50 to 60 cc syringe to the suction channel cleaning adapter. Fresh or reused actively effective disinfecting solution should be flushed through the entire suction system. Repeat to confirm contact of disinfectant with all channel surfaces. As long as the entire instrument remains completely immersed and all channels remain filled with disinfectant, all cleaning adapters, rubber inlet seal, and syringes used in previous steps should be removed. The removal of component parts and cleaning adapters from the endoscope will eliminate the risk of mated surfaces not being exposed to the liquid chemical germicide. Warning: it is imperative that all internal surfaces of the channels are in contact with the disinfecting solution for the time period recommended by the manufacturer of the solution. While fully immersed, manipulate valve mechanisms and use a syringe to inject disinfectant through or into removable scope components. This will remove entrapped air bubbles that could inhibit contact of solution with component surfaces and provide for better exposure of surfaces to germicide. Make sure disinfectant is injected into or through the rubber inlet seal. The endoscope component parts should remain in contact with the disinfecting solution for the time period recommended by the manufacturer of the solution. After the endoscope and its component parts have been in contact with the disinfecting solution for an appropriate time, flush all channels and components with air to purge remaining disinfectant. Then remove the scope and its components from the solution. Transfer the endoscope and its components to a basin of sterile water. Thoroughly rinse the entire endoscope and its components parts with water. Reattach the air-water cleaning adapter OFG17. A syringe filled with sterile water should be attached to adapter OFG17 to flush disinfecting solution from the air and water channels of the scope. Most high-level disinfectants require triple water rinses. Fill a syringe with air and flush through the air and water channels several times to force any residual water out of the tubing and nozzles. Dry thoroughly. With the suction nipple cleaning adapter OEC8, air-water instrument channel cleaning adapter OFB166, and the inlet seal attached to the scope, rinse the entire suction instrument channel with sterile water. Most high-level disinfectants require triple water rinses. Flush air through the suction instrument channel several times to remove residual water. Dry thoroughly. Note: all final rinses should be made with sterile water or bacteria-free water whose microbial quality has been confirmed via monitoring. After water rinsing, 70% alcohol should then be flushed through all channels, followed by compressed air not greater than 24 psi to facilitate drying. Channel cleaning adapters should be used for alcohol flushing or rinsing and forced air drying. The outer surfaces of the endoscopes can be dried by gently wiping with a gauze or lint-free cloth saturated with alcohol. Regardless of the quality of the rinse water used, a dry instrument achieved by a final alcohol rinse and forced air is essential to prevent bacteria colonization and/or infections associated with waterborne microorganisms. Such infections are more likely to occur when wet or contaminated instruments are used on patients whose immune systems are compromised or suppressed. Gently dry all external surfaces of the endoscope with a soft gauze or the like. Dry the objective lens with a lint-free cloth. Post-disinfection. If for immediate reuse, ensure that the instrument has been properly inspected and fully prepared for the next clinical procedure as per the instructions found in the Pentax operation manual supplied with each instrument. During testing or inspection of individual scope functions, such as air, water, and suction, use only sterile or fresh distilled water. If the endoscope is to be stored, ensure that all internal channels are completely dry. It is imperative that all air-water valves, suction valves, inlet seals, and any other removable components are detached from the scope to allow for better air circulation throughout the internal channels to ensure thorough drying. The endoscope should be hung with the insertion tube and umbilical cable kept as straight as possible to allow any residual fluids to drip out of the scope. The storage area should be dry and airy. Never store the endoscope in areas of high humidity, high temperatures, or in direct exposure to sunlight or X-rays. Never store the endoscope in its carrying case. Avoid storing in cabinets that have sharp edges or exposed nails or screws. Pentax special features. Forward water jet system. All earlier video segments have dealt exclusively with the typical Pentax gastroscope containing 3 internal channels: air, water, and instrument suction. The Pentax EG2970K and EG3470K gastroscopes contain an important special feature, the forward water jet channel. Pentax 70, 72, and 70K, 72K colonoscopes also contain a forward water jet channel and/or a secondary biopsy channel, all of which must be properly cleaned and high-level disinfected or sterilized. Reprocessing instructions will now be reviewed for more complex Pentax gastroscopes and colonoscopes that have anywhere from 4 to 5 internal channels. These color-coded internal schematics illustrate the independent forward water jet channel on a Pentax colonoscope. The Pentax water jet feature allows physicians the ability to shoot a forceful stream of water at a target site via a manually operated syringe or a foot-controlled irrigator pump. It should be noted that regardless of whether the water jet system was used during a procedure, it must still be reprocessed before every patient use. The air, water, and instrument suction channels of a single-channel Pentax colonoscope are reprocessed in exactly the same manner as described for the 3-channel gastroscope. Therefore, rather than being redundant, we will proceed to review the reprocessing of the Pentax special features. For the sake of brevity, we have also taken the liberty of simulating the basic reprocessing steps without the inclusion of fluids. Naturally, to accomplish successful reprocessing, complete immersion and contact of all internal and external endoscope surfaces to reprocessing agents is mandatory. The forward water jet channel is composed of several removable components, each of which can be brushed clean and then exposed to an enzymatic detergent. During pre-cleaning, immediately after the procedure, the forward water jet channel should be flushed with water or enzymatic detergent solution. Using a syringe or irrigator, flush solution through the irrigation tubing OFB 113 directly into the forward water jet port located on the PVE connector. Purge the channel with the syringe and air several times to force any residual solution out of the channel. During leak testing, remove the individual water jet components, OFB 113 irrigation tube, OEC12 water jet check valve adapter unit, and the OFB 118 connector cap as illustrated. Use the CS-C8S cleaning brush to scrub clean the inside walls of the water jet cylinder on the endoscope PVE connector. Manually brush clean each individual component using the CS-C8S brush. Reattach the water jet check valve adapter OEC12 to the PVE connector on the endoscope. Note that during the cleaning process, it is recommended that the rubber check valve OEC14 be removed from the base of the OEC12 check valve adapter prior to reattaching it to the scope. This will allow for unrestricted flow of solution into the small water jet channel. Now, inject cleaning solution into the water jet channel just as you would for all other internal channels. Make sure the detergent solution exits the scope's distal tip. Allow the channel to soak in detergent solution for an appropriate time period. After rinsing and drying of the water jet channel, fill it completely with a high-level disinfectant. Providing the entire instrument is completely immersed in disinfecting solution, all water jet components may be removed from the scope and soaked in the solution. Note: ensure proper contact of all exposed surfaces to the disinfectant. Follow by thorough rinsing and drying of the water jet channel. As with all internal channels, alcohol followed by forced air should be used to facilitate drying. Two-channel endoscopes. The most popular Pentax colonoscope features two independent instrument suction channels, a primary larger biopsy channel and a smaller secondary instrument suction channel. A special suction selector mechanism allows the user the choice of suction through either channel or simultaneous suction through both primary and secondary channels. During pre-cleaning of the two-channel colonoscope in the examination room, enzymatic detergent solution should be suctioned through both instrument suction channels using the instrument selector mechanism to direct suction to each separate channel. During reprocessing of the Pentax two-channel 70, 72, and 70K, 72K series colonoscopes, the suction channel selector mechanism OFB161 must be removed from the colonoscope and thoroughly cleaned. This includes brushing of the selector mechanism as well as brushing of the receptacle for the suction selector, followed by exposure to an appropriate cleaning solution. Both the small and large instrument suction channels must be thoroughly brushed clean. As with the standard single-channel 70-70K gastroscope or colonoscope, the suction channel within the umbilical cable is brushed in a similar manner, from the opening of the suction nipple on the PVE connector to the suction control valve receptacle on the control head of the endoscope. Repeat as necessary until the brush is visibly clean. Next, insert the blue-coated end of the CS6021T cleaning brush into the opening at the bottom of the suction control valve receptacle on the control head and gently advance until it exits the cylinder of the instrument channel selector. Grasp the back end of the brush shaft, blue end, and then gently pull the brush from the cylinder of the instrument channel selector. Do not use excessive force. Repeat as necessary until the brush is visibly clean. Note: when using the tri-bristled cleaning brush CS6021T, slowly remove it from the endoscope, being careful not to fling patient debris or contaminants into the air as the bristles exit the scope. Insert the blue-coated end of the CS6021T cleaning brush into the instrument channel inlet and gently advance until it exits the scope distal tip. Grasp the back end of the brush shaft and gently pull the brush from the scope distal tip. Repeat as necessary until the brush is visibly clean. Repeat this brushing procedure on the second instrument suction channel. Caution: the CS6021T cleaning brush is for one-time use. Never reuse the brush on more than one endoscope. The entire endoscope, including all internal channels, must then be exposed to an enzymatic cleaning solution for the time period recommended by the manufacturer of the solution. Note: to ensure contact with all instrument suction channel surfaces, each channel should be flushed separately with detergent, disinfectant, and rinse water. Use the suction selector mechanism to alternately direct flow into each separate channel. Providing the entire endoscope remains immersed under solution, the suction selector mechanism should be removed and soaked separately in detergent and then in a disinfectant. Note: regardless of whether both channels and the suction selector mechanism are clinically used during a procedure, all must be reprocessed. Other features: elevator mechanism. Traditionally, endoscopes such as side-viewing duodenoscopes with elevator mechanisms and exposed elevator wire channels have been considered the most difficult to properly reprocess and pose the greatest risk of infection to patients, especially those whose immune systems are compromised. Conventional elevator mechanisms are controlled via a control wire, which travels the entire length of the insertion tube. Due to the very limited amount of space between the elevator control wire and the internal channel it's housed in, higher than usual pressures are required to inject reprocessing agents into this area. Pentax 7070K series duodenoscopes eliminate the need to reprocess this internal channel area because its control wire is completely sealed and never exposed to potentially infectious patient material. A comparison of these two designs reveals an exposed control wire on older instruments. On current generation Pentax duodenoscopes, one cannot see a control wire because it is completely sealed within the scope tip. However, it is still very important that the distal end of the duodenoscope, especially the actual elevator mechanism and area surrounding it, be properly cleaned and reprocessed. All areas surrounding the elevator mechanism should be brushed clean and exposed first to an enzymatic detergent and then to a disinfectant. Syringes should be used to flush reprocessing solutions directly behind the elevator. All accessible internal channels should be cleaned by brush and then exposed to a detergent solution for a time period recommended by the detergent manufacturer. After rinsing and drying, all internal channels and external scope surfaces should be exposed to a high-level disinfectant, rinsed, and dried again. This in turn must be followed by a final alcohol rinse and forced air drying of the channels at no greater than 24 psi. Pentax endoscopes have been designed to provide years of dependable service, provided they are properly cared for and well maintained. It is strongly recommended that appropriately trained personnel who are competent and knowledgeable about endoscopic instruments, antimicrobial agents, reprocessing equipment, and hospital infection control protocols be involved in the reprocessing of these medical devices.